Lisa here. Thanks for clicking on this video. This is another video in my nursing series on YouTube. Today I want to talk about introverts in nursing. Often people ask, can I even be a nurse if I'm an introvert? I kind of want to tell you my story and where I'm my nursing journey and where specialties I'm looking to go into. Um, so I in my program, I had one semester off out. We're in December now. In September, I was supposed to finish and do my preceptorship. If you can go back and watch some of the other videos, but didn't work out. It was a big mess. I don't know. I didn't get any of my choices back then. I was adamant to only do mental health or public health. Not only am I an introvert, I thought that was the best areas for me. I have previous wrist injuries that make areas like med surg really challenging physically, and then I find it really emotionally exhausting, like the constant. It's a very chaotic environment for those of you who worked in med surg. And then for the longest, I was like, oh, mental health is suited for me because I'm one-on-one, with the patients and, with therapeutic communication, and it's not hard on my wrist. But the other part of it, I think, is the longest time I worked in the community as a mental health worker with clients who are stable at their best. But as you know, when people are in acute psychiatric crisis, it's challenging. Clients could be yelling, screaming, and so it's not good for my nervous system. I know I was raised in a home in conflict, so anytime I hear yelling and screaming, actually I freeze. So and my body shuts down. It's like I don't want to, but it does. So that's not the best area for me, like with clients like that. And then I can't really help them as a nurse. So, and I've been doing it for so long, over 13 years. Like, you know what? I'm looking for a change. I want to do something else. So for the longest, I wasn't sure if I was going to finish my nursing program because, like, if I can't do mental health, I can't physically do the other areas. And there's certain areas they don't want to hire new grads. There's not much I can do. And so I was like, oh, maybe I should just give up nursing altogether. And so this past couple months, I'm taking a break, just working. But recently, I talked about this in another video, but I had an experience with a family member in the ICU, and that actually reignited my love for nursing and actually critical care. I didn't get it. I experienced to go to the ICU, my nursing program. But when I was there, I wasn't even thinking about nursing. I was just there to see my loved one. But my training kicked in, actually helped me get through the whole thing. I was calm, I was grounded, I was advocating for my family member while other family members were in crisis or freaking out, rightly so. Um, and then, yeah, I was with the nurses there when they did their assessments. I knew what they were doing, and I was looking at the medication. Oh, they're taking this because of that. And sorry, my nose is itchy. They were looking at the blood pressure. Oh, why it's low because of this, and they're doing this. All the critical thinking just comes into play. And I was there for the meetings with the social worker and the ICU doctor and, all these. And so, yeah, I really love the ICU. I don't know if I would do adult ICU because, yeah, you're not lifting anyone, you're using, I think, lifts, but maybe any ICU nurses who work with adults, if you can comment below, how physical is it that working in the ICU? I know you're repositioning people every few hours. I know you have help to do it. I'm just kind of leery of that area. Um, yeah. And so this whole thing made me think, I love nursing. So what I'm looking to pursue, I'm no longer interested in mental health. Now I'm interested actually in pediatrics because that whole situation made me realize that I do great in dealing with families. If I can handle my own family, then I can handle someone else's family. Stay calm, provide education, get them through a crisis, and critical care. So I'm thinking of like pediatric ICU, um, pediatric med surg, or anything like that, or even NICU. I'm really passionate of just supporting families, and I know what happens. Especially, I know what it's like to come from a family of dysfunction and addictions, and just you add it into the mix. I'm not saying all families go through that, but I'm saying coming from that experience, I want to be the leading light, the torch to guide families and support them through their crisis. and so their child or their young person can be better, and they can go home. And so I'm getting to the point of this video. So people don't really talk about like pediatrics for introverts. I feel like a lot of people, most people said they say things like, I see you, of course, yeah. And so like critical care nursing is a good one because your patient is sedated usually, and the families aren't usually there to do just normal chit chat. They're in a crisis situation, or night shift if you want even less interaction. And it's also procedural, like I can call it controlled chaos. Like the ER, no way, that's just chaos. But because there's so many policies and procedures that you're following with the team, things can happen. But I just feel like it's a more controlled environment. That's what I saw anyway. But from my experience, I feel pediatrics actually is a good place for introverts because I noticed the difference between peds nursing versus like med surg. Um, you're more in tune with the child's schedule, letting them sleep longer. You're not rushing in at 7 a.m., giving meds, doing vitals. The parents are there, so it's family-centered care, which I love. They become almost a patient. They're involved in the care. And so I really love that part of nursing. And when did my peds rotation, I wasn't really looking forward to it because I was like, I'm not a kid person. I don't have any kids, never want any kids. But I actually enjoyed it. And I was working with one youth, special needs, and the mother, they were going through surgery, and I was with them pre-op, post-op, which is neat because nurses won't get to, because you don't get to see all of that. Usually you're with them before or maybe after surgery, the nurses. And I remember when I left, that mother always left a mark on me. She's like, don't forget, maybe work in pediatrics. And I was like, yeah, I don't know. um, the point is, you never know where you're going to end up, where you're in school. I was so worried about my peds and maternity rotation, kind of for personal reasons. And also, I never had kids. I'm not a kid person. And like that. But here I am. Um, I want to be a pediatric nurse because I know I can make a difference. And I'm really passionate about family-centered care. Yeah, like so it can be a great place for introverts because you're also using a lot of relational engagement, one-on-one with the families. I'm sure it could get busy, but I just felt there was more time. I don't know, it was better with families. That's what I felt anyway. So that's what I'm pursuing. Yeah. So yeah, what other areas for introverts? So peds, the OR, there's another area I was looking into, but maybe any OR nurses chime in. Um, I'm worried about the physicality of that job, heavy equipment. I suppose I could always do peds or how physical is it on your arms, on your wrists. The OR. That's another one that's great for it can be great for introverts. It depends. I've heard one person say that it depends on your team. And so if you have, I think, a good team, but if you have people like very chatty, I think maybe it's a struggle for introverts. And also the PACU. I originally wanted to do that, but I was like, how do I go into that? I have to do med surg, and I can't do med surg. And so now coming from nursing from the pediatric angle, PACU for peds, or eventually maybe PACU for adults. Yeah, and so I'm really grateful for actually the time away. I was really heartbroken when I had to step away from the semester and not graduate with the rest of my cohort. But I'm glad it didn't work out with mental health because I'm not meant to stay there. I wouldn't, and then horrible as the experience was, my family in the ICU, it was life-changing for my family member for sure. They made it through, but it's life-changing for me and my profession and nursing in general. And I'm like, am I gonna forget my nursing? No, the stuff that matters kicked in and it allowed me to get through that. And yeah, like in the new year, like I'm starting slow. I'm going back to school to finish my last semester. That won't be until the fall of 2026. But I'm going to take a pediatric theory course. Where I live, they have what's called Employed Student Nurse Program. So I finished last year. The hours were used up in mental health. But now I'm going to try to get in one in pediatrics because that'd be a really good use of my time for the next 9 months. It allows me to earn money and also it'll give me experience, pediatrics. So with this course, and with the experience, I'll feel way more confident going into my preceptorship, because taking a year off, I was a little nervous. I was like, am I going to forget everything? And how is it going to go? And so also taking this course will allow me to get in the swing of things of school. Because I was in an accelerated program. So I was always constantly studying in school. I was like, and I would have 3 semesters a year, a month off between each semester. And I was just burnt out. And actually, honestly, I was broken with the whole nursing thing, because my preceptorship didn't work out. But it's a blessing in disguise, and it all worked out. So if you ever need a break from nursing, I would recommend it. So yeah, these are a couple areas that I feel introverts would be good at. There's some other areas. Well, of course, I think generally people always say, yeah, night shift. If you're able to do night shift, less visitors, less people, less management, just less people in general. And there's always other areas, see, like research, I think. But yeah, let me know if you're introvert. What area of nursing do you work in? What areas have worked for you? All right. Thank you everyone for watching. I will see you in the next video. Take care.